easy for us to understand. Like history of immunodeficiency could have been added. That pattern of stool, like was there any blood or mucus in the stool, that could have been added. Tummy pain,
No,
vomiting,
blood
history.
was. I think I asked blood.
Maybe
Blood in the.
maybe I did not hear it properly. And vomiting and the fever you asked, it was good. Just adding few things which was
Yeah.
not negative, but like if we remember, that will be an added thing, good thing.
Yeah. Yes.
Hmm.
Right.
So,
Okay.
okay. Like, and
Fine.
regarding diagnosis, like if initial test will be IgA, total IgA with IgA TTG. If this is more than 10 times, then for diagnosis we have to again repeat the IgA TTG, confirm it that is more than 10 times, and do HLA testing. If the HLA testing is positive, then biopsy is not required. If the IgA TTG is negative and total IgA is normal, like IgA TTG is less than 10 times positive but less than 10 times, then you ask history regarding the adequate gluten intake. If it is there, then like if you are strongly suspecting the disease, then you can go for biopsy.
Yeah, biopsy uh, at the last resort only if
Yeah,
the
yeah,
tests are negative and all.
yes, yes.
Okay.
Little bit complicated, we have to read it ourselves so that we will understand it
Mhm.
properly.
Yes. Yes.
Okay. So Dr. Tamanna, can Gurudev,
Dr. Tamanna is here. Yeah.
yes,
Oh,
Misha is Tamanna, I think.
okay.
Okay. So Dr. Maila is not here. So we can do. So Dr. Jay, would you like to be candidate?
Okay.
Okay. So who will be role player? I'll be. मैं थक गया. Hiren, you be role player.
One cannot be a role player. Yeah, no issue.
So I'll keep the time. So
Okay.
child, 10 days old neonate is admitted in the NICU, and child has received the gentamicin dose. Instead of at 36 hours, he has received at 24 hours. Explain to the mother the reasons and apologize. Address the concern. So when you're ready, just let me know.
What is child's name?
Child, you can do Ahmed, our favorite.
Okay. Mm-hmm.
Ready? I'm ready. Huh? Once you are ready.
Okay. Good afternoon.
Good afternoon.
I am Dr. J, one of the neonatal registrar looking after Emma.
Yes, doctor. How is my baby?
So she is stable now, but today just I want to discuss the more in the condition of the Emma. So have you been informed by our team regarding the Emma condition?
No, doctor.
Okay. So just I want to discuss. Is there anyone to join our discussion? Anyone else?
No, my husband, he went to home.
Okay. In fact, Emma is receiving one drug, that anti-bug, uh, for the we have given that medicine and drug, but that what we have given bit earlier, that should ideally be given at the 36 hour. Instead of that, we have given bit earlier, 24 hours.
But why, doctor? and what it will make difference to my baby.
Yes, that I want to tell you. Right now the condition is stable, but sometime this by mistake it has been given that needs to be sorted out. But certainly that drug, every drug has its own side effects.
Okay.
So just I
So
want
what will
to,
happen, baby?
yeah, yes, tell me.
What will happen to my baby?
Yes,
Is he
right
going to
now,
be?
yes,
Is he all right?
yes, he's doing well. Baby is stable now. We will monitor the condition of this Emma, but sometime may affect the, sometime may be overdose or it may be given bit earlier, so it may sometime affect the some hearing, sometime may affect this kidney function.
Okay.
Mm.
So how I can be sure that his kidney is now doing well and there is no issue with his hearing? You made me scared, doctor, actually. If it affects the hearing and kidney, it means, my child can be in danger.
I understand this is very difficult situation, it is indeed worrisome, but let me reassure you, Ahmad is stable, and we have done the blood test to determine the kidney functions, which are normal, which are within normal limit. And once we will discharge, and then before discharge, we will do also the, to ensure there is any hearing deficit. So are you with me?
Yes, yes, doctor.
Mhm.
Oh, it's so. What's the solution now, doctor? Did you stop that medicine now?
No, just we will just send this, the drug level anti-bug drug, that the name is the gentamicin, and
Hmm.
we have the blood level and also these other reports as I told. And once if the reports is not in the danger level, or it is not that much, and then we will continue with that, because
But
yes,
doctor, now I don't want my child kidney to get damaged. So I want you to stop the medicine. I don't want to give that medicine. You already gave it early, and you told me that it affect kidney and hearing capacity. So please stop that antibug therapy. I don't want to give that.
it is understandable concern. Your, I appreciate your concern. But once if we, as compared to the risk, the benefits, it is must, as far this condition to treat, it is very much important. And we will give in this minimum dose, and we will monitor, as I told, we will monitor the blood level, and we will give in the appropriate dose, so then it would be advantageous
But
rather
now
to
I'm, yeah, I'm more worried, doctor. Who did this mistake? I want to file complaint against that staff. Who is responsible for this?
you are right. At this point of time, I am not in position to tell you the specify the name of any person, since it is not a mistake of a single person who did, because it is the right from this pharmacy, from this prescription, from to dispensing and administration, that needs to be sorted out. And we will look into matter, and we will fill the incident form, and so we will avoid this mistake next time.
Mm.
In future it
Doctor,
would not.
so you mean to say your whole system is corrupt and your whole system is faulty, even though somebody write a wrong dose, the pharmacist also does not look into that, and the nurse also does not look into that further. That's what you mean to say, whole
6
system
minutes.
failure?
Yes, but it is not, as I told, it is not, I cannot specify, because mistake can be at any step, just I told you, because it is just a chain. So that needs to be sorted out. It's not whole system is to be blamed. It is maybe that to be pointed out where this lapse occurred. That will be sorted out, and accordingly we will be in touch with you, and will inform you, and we will also raise the issue to the also clinical governance team.
Okay, okay, doctor. Okay.
So any other concern?
Yes, doctor. If he becomes deaf or any kidney problem, how are you going to manage him? What you will
Okay.
do?
Yes, right now he's doing well. Right now, since these kidney functions, they are within the normal repeat. Say for if it is deranged, then they are irreversible. They may be revert to the normal. So we will monitor, and then they can be returned to the normal. And as far this hearing, if there is any hearing deficit, and then we will arrange a one session with this ENT specialist, ear and nose doctor, and so he will guide you further.
Okay, okay. Thank you, doctor.
Okay,
Thank you.
so okay, thank you for your time, for listening patiently.
Okay, still 1 minute 15 seconds
Yes,
remained. Huh?
yeah. Yes, just I don't know. This is the critical incidents whether it is to be summarized regarding the website and this trusted materials to
No,
go
no,
through. Mhm.
it's
Okay.
more actually sympathetic. Doctor, here and give
Mhm.
your feedback.
Mhm.
Yeah. Dr. Jayaprakash, you did well actually. I'm sorry that I was more harsh. I
No,
think.
no, no, that is very much. We should be like that. It is an actual scenario. But to be honest, I was not ready as a rather role player. But anyhow, in an exam, we don't know. Yes, tell me further your input.
Yeah, I put all the worst question
Mhm.
in front of you.
Mhm.
You still maintain the calm and you did in a correct way.
Mhm.
Uh, Only few things like this, like issue of the system and all. Everyone, some of them, they are saying we should mention as a system and not as a person. But I think
Mhm.
when we say this sentence, no, somehow we are putting ourselves in a risk, like in a taking another meaning. Like you mean to say whole, like I took a wrong meaning like, when you say it like this, right? You mean to say
Mhm.
like whole system is faulty. Then
Mhm.
I don't trust this hospital at all, like this.
Mhm.
But the
Mhm.
idea here is to put in a right way, like its chain is there. I don't know exactly where it is affected, whether it's a level of staff, whether it has something went wrong in the pharmacy or at the level of dispensation of the medicine. So we are
Mhm.
still looking into that. And
Mhm.
for that, we are still investigating and we are like, we have generated incident report for this.
Mhm.
And already the meeting has been conducted for this, and the head nurse and the head of the unit or the consultant and the floor manager also has been updated. And we are taking a serious note of this.
Okay.
That way, I think slightly better. That
Mhm.
saves us. And I ask you like question, what you will do uh, if you become deaf and all these things. So you explain nicely. Yes, we will monitor, and but still just little bit firmly. We need to say like the possibility of that is very extreme, which is very very rare. But still looking into this into the mind, we have requested the test, and still we are waiting for the result. I hope it will come normal. And if it is not, then we have this doctors called nerve doctor. Uh, I don't know. No, it's a ENT or the neurologist.
ENT, ENT.
ENT. Yeah, ENT ear doctor and the kidney doctor, which we can refer, which you already mentioned. I'm just putting in a right uh, way, so probably it will be better. And other thing, closure and all, you are like smartly you said. Here there is, I think, leaflet and all. It's not very much needed. And summarizing also, I don't know, here is a mixed out. Some people say summarizing, or some people say
Yeah, we can
better not
summarize
to
if
do.
we have time, but don't offer the leaflets and materials and all
Mhm.
support group. Don't offer, but we can summarize. You're
Yeah.
like, if you don't mind, can I go through the various points which we have discussed? And she says, yes. Then we can say, like, today I am here to apologize regarding the some incidents regarding the drug administration. Your child received gentamicin little early. For that, we are monitoring the child, and we have discussed what step we will uh, what step we will take to prevent further damage, and what corrective step we will take to prevent this problem. But you insist for complaint, and for that I have assured you that I'll guide you through the paths, blah blah blah, something like that. This is
Any
it.
other further apart from
Apology was just generally in this scenario, one or two times sorry is expected.
Yeah,
We are
apology, you should start
extremely,
with the apology actually.
yeah.
Mhm.
You did not start with the apology. The agenda you could have like said like, I am here to apologize for an incident which has happened yesterday or today morning, whatever the timing, that there was some drug error in the in your child's treatment. From there it will start actually. Start with the apology.
Hmm. Hmm.
Don't
True.
be on the back foot.
True.
Start with the
Right.
apology. That is the main thing here.
Hmm.
Then she will start screaming, Dr. Hiren was very nice. You will not find
Hmm.
such nice role player in the exam. Okay. Like you were
Uh,
suddenly told to take this task, maybe because of that, it a little bit you were means like there were some points which were coming first and somewhere later. But overall, it was okay.
Okay.
You can listen again and see. Huh?
Okay.
Chalo, so how much time we have left?
Diagnosis in the Dr. Herons, the celiac disease, we should also this cow's milk protein allergy and also GRDS is also mimics initially with this celiac disease. No?
yeah,
And
yeah. So it's like infection, gastroenteritis, and cow milk, other food allergy we have to rule out. Yes.
And as far Dr. Sandeep told also for the stool, we should dig out more history, should inquire regarding this stool character and also for mother, is it easy to flush? No doubt you might ask for greasy stool or anything offensive smell, but also we can ask like that, is it easy to flush? For the mother, easy to understand.
Mm-hmm. Malabsorption type of like.
Yes, yes, estetoria, what in our language, yes.
Yes, yes.
Mhm.
Okay.
Okay, so I will do the case.
Yeah, so
I
we'll
don't know
do
how
this
much
a
time
neuro
is left.
case.
Still, we can finish, I think. Okay.
So you are doing
Case number 4, page number 295.
case number. Too much WhatsApp.
Whose call is ringing?
Um, my
No, no,
sorry.
no problem. You take
Okay.
your call, no?
No, no. Actually, WhatsApp. Lot of sometimes people send flooded message. Okay. So I will give you the case statement. Uh, please examine uh, motor neurological examination of this child who is 8-year-old child who is on the wheelchair and
Hmm.
has difficulty in walking.
Okay. So, Dr. Jayaprakash, 6 minutes plus 3 minutes, huh?
Okay.
Okay. So, I will verbalize, try to verbalize according to new system, huh? Okay.
Yeah.
Whatever my understanding is, I don't know is this a correct way. So after entering in the room, I will introduce myself. Hello, I am Dr. Sandeep, one of the candidates here. I'll greet the mother and the child. Hello, what is the name of the child?
Child name is Ahmad.
Okay, hello Ahmad. Then I will assess the speech of the child and intelligence in that. Meanwhile, I'll gel my hand and I'll take the permission from mom. Hello, mom. I would like to examine your child. Is that okay with you? Then I'll take permission from the child. Hello, Ahmad. I will be examining you for few things which will involve walking and doing some movement. Is that okay with you? Then I'll confirm with the mother. Can Ahmad walk? And if she says yes, then can John walk? Yeah.
Yeah, he can walk.
Okay. So I'll meanwhile I will have a first look at the child. I'll see for any dysmorphic feature, growth of the child. Then I will see whether he's in distress or not in distress. I will see and for any equipments in the room, like as he's on any wheelchair already, any medicines in the surrounding area. Then after that, I'll ask the child to walk, and I will see while I will be sitting on the knees, and I'll observe the gait of the child. So I'll ask to go walk and observe the child. So what gait can I expect here?
Yeah. So gait is like kind of a diplegic gait you are observing.
Okay. Okay. Then I'll ask for the adequate exposure. Like ideally at least below knee. I'll request the child and mother so that I can get adequate exposure of the limbs. Then uh, I'll while the child is standing, I'll have a look at the back also to see any scars, kyphosis, scoliosis. After that, I'll ask the child to sit on the couch, preferably lie down on the bed. Uh, then I'll observe the limbs, lower limbs. I'll see for any atrophy, asymmetry, scars, then color of the skin, uh, then posture of the limbs, any operative scars, contractures. I will specifically look for. Uh, After that, I will assess the tone in the lower limb by doing some. First, I will look for the posture. Then I'll do some passive movements at the hip joint. I will do adduction, abduction, passive movements. At the knee joint, I will do flexion and extension and feel for hamstrings and quadriceps muscle. At ankle joint, I will do dorsiflexion and plantar flexion and feel for this gluteus and anterior compartment of the muscles. Then I will explain the child about the power. First, I will see whether he is able to do against the gravity, which will ensure the power of more than grade 3. At the hip joint, I will test for the flexors and extensors, group of muscles. I'll ask the child to draw the limbs towards him. If he is able to do, then I will try with against some resistance on the both sides. Actually, I will try. Then after that, at knee joint, I will ask the child to do flexion and extension first against the gravity. If he is able to do, then I will do it against some resistance. Then at ankle joint, I will do dorsiflexion and plant. I ask the child to do dorsiflexion and plantar flexion to assess the uh, gastrocnemius soleus muscles and anterior compartment of the leg muscles. So I will do all the maneuvers on the both sides. So what power I can expect here?
Yeah. So tone you find that increased tone in both the leg and power it is 4/5 in both the leg.
Okay, and tone is increased.
tone is increased.
Okay, and then I will do the reflexes. I will find the patellar tendon on the anterior aspect, just below the patella. I'll tap with the gently with the hammer and see for the reflexes. For ankle jerk, I will find the Achilles tendon and do gentle tapping and compare reflex on the both sides. Also, I will strike with a firm object on the foot from the lateral side of the foot. I will without causing the pain to the child. Just I will strongly strike the foot and bring to the base of the great toe and see the fanning of the fingers and movement of the this great toe. So, what reflexes I could expect here?
So there is a fanning of the toes and great toe is going up.
Okay, then I will ask the child to do coordination movements like heel shin test with the ankle, with the heel of the one leg to rub against the shin of the other leg. So I will assist the coordination. Then I will like to do this upper limb motor examination uh, in a similar way. Like I will at the shoulder joint tone, I will assess by flexion, feel of the muscle and flexion, extension, and adduction, abduction, passive movements, and flexion, extension, and pronation, supination at the elbow joint. And at the wrist joint, I will see the position of the wrist and do dorsiflexion and palmar flexion. Then for power, I will assess at the shoulder joint by shrugging of the shoulders and flexion extension in the plane of gravity and against the gravity. Uh,
6 minutes.
okay,
Yeah. So upper limb tone normal, power also 5 by 5 normal.
okay, okay. So today I have examined 8-year-old child who appears averagely built. I would like to plot him on appropriate growth charts on motor examination. I find upper motor neuron type of signs in the form of increased tone, brisk reflexes, and positive Babinski sign. His gait is a diplegic gait, and his power is grade 4 by 5 in both lower limbs. Upper limb also had some upper motor neuron type of lesions. So, considering all these findings, I would like to put my first differential as a uh, diplegic cerebral palsy.
Okay. So what are your other differential?
So, other differential could be a spinal tumor or could be a so I cannot think more than this. The other differential.
Okay. So uh, how you will manage this child?
Okay, I would like to do complete examination, physical examination, and would like to take detailed history, especially the birth history and perinatal history and developmental history. I would like to assess the cranial nerves also in physical examination. Would like to assess the overall functionality of the child regarding management. This child would require occupational therapy and physiotherapy to avoid contractures, provide some orthosis, and may need some home modification. Uh, Other management would include the management of comorbidities associated with like any schooling issues needs to be addressed if they are there. Any epilepsy, if there, then that also needs to be addressed. Also, family may need some social support. So I would like to involve social worker here If the child has the neurological issues, then referral to a neurologist and a developmental pediatrician would be appropriate here. Also,
Time finished.
okay.
You can
Okay,
complete. Mm.
complete. Yes.
Yes, then also there may be need for dietitian and speech and language therapist reference in case the child has any feeding issues or any bulbar palsy associated with this cerebral palsy.
Okay, fine. So, Sandeep, you did good. Your speed was excellent.
So I don't
Very
know, this is
super
right
fast.
or wrong.
Like Rajdhani, Rajdhani Express. You are going like Rajdhani.
Examiner should not feel like this रट्टा मार के आया है करके.
Two, three things I need to tell.
Yes.
Actually, case was Tech 6CP, but then I give you
Yeah,
diplegic
yeah, yeah.
compound.
You are smart in doing that.
I I did not give you the Tech 6 thing because
Right.
otherwise,
Extempore
lose it.
cases are actually very important.
Yeah. So uh, good. I mean you went according to that the findings given to you. The one thing is like you are not taking pause in between. Like you are continuously saying, I'm looking for this, like in a sentence.
Right, actually,
So you,
like pauses are very much important. But like say that they said like examiner will provide clues at appropriate level and you should take appropriate pauses. But where to take pauses, yeah? Like that is very difficult. Like I think we can take pauses at the end of tone, at the end of power, at the end of reflexes.
yeah.
There,
Like a main stations, no tone,
right,
power, reflex. You need to
right,
know these are the
right.
main checkpoint, right?
Right. See, even if
So
I did not take pauses, I spoke short sentences, still I could not complete the exam. How we
yes,
are going to finish it? Yeah.
yeah, you were going extremely fast, and still
Yeah.
at the end of 6 minutes, we notice that it is less. So if you take pause, then it
Don't
will
know. I
take
think
more
they will
time.
do the only lower limb task or any upper limb task. They will not take, say, the motor examination.
Yes, yes. So
Like
most likely they will
with
just
with
restrict it.
this exam, they will learn few things like the candidate is not able to finish. First thing with verbalization.
Hmm,
So they will, I
hmm,
think, will shorten the tasks. What is my understanding about this is that in clinical they will
hmm.
shorten the task. Long clinical they don't have to worry because they have given more time. Long clinical, but short clinicals they
Yes,
will reduce the time for verbalization for sure. At least in neurological cases, the task will be short. So let's
yes.
the things come up like they will give some feedback after a few days.
And but like one more thing is like you said to complete your examination cranial nerves and all. You said it on later on, which you could have tell in the like after you finish, no?
Right, right.
You
Some
have to say
summary I could have said. That was in
not
my
in the
mind, but like
management
see
part.
during presentation it goes. That's why we need to practice.
Yeah,
Like,
that time you could have
hmm,
said this thing.
right, exact. Very important point.
Yeah. And one point also, like you said, upper limb also there is some upper motor neuron. Upper limb, I said everything normal, tone,
Yes,
power, everything
actually,
normal. But
I thought you will not catch this point, but after saying after saying, I realized that I did a blunder, and
uh, you said like this.
it is
So
like clear fail mistake.
yeah, yeah. Something, you gave other wrong things,
So, what
which was
differential
not
we
there.
can say, like apart from diaplegic cerebral palsy, what differential we can say here?
You can say the possible quadriplegia, but the upper limbs are normal. So less likely. You can also there is one condition in which happens in IUGR baby.
Hmm.
little disease or something like that also have same like diplegic gauge.
So what we have to do? Like we say, have to say the differential, and we have to say why it is not possible, or we just have to blur the differentials. What is expected actually,
At
ideally?
least, the nearby you have to say, I think, like because the cerebral palsy, what else you will say? You have to say something like, okay, I can think of quadriplegia, but upper limbs are normal.
Okay.
So at least justification, I think, not the it's kind of a clinical reasoning or justification.
Because see,
You
like
can say,
we have only 3 minutes for presenting the case as well as the discussion from the examiner. If we say present the case, that will take 1.5 minutes. In 1.5 minutes, only differential we keep on justifying, then examiner will not have any other chance to ask any other questions.
yeah, that's what no, they are saying appropriately put. I don't know what is appropriate.
सबका अप्रोप्रिएट अलग अलग होता है यार.
सबका appropriate अलग अलग होता है वही तो.
जैसे सबको अलग अलग बीवी मिलती है, जैसे सबका अप्रोप्रिएट अलग अलग होता है, वैसे ही है. Ultimately there has to be some consensus, yeah, uh, like mathematic table, there has to be some consensus. Like it, we cannot do it on our way. I feel this, maybe with practice it will come little bit better. I think we are doing better than before.
Yes,
Let's
we are
continue.
becoming better.
Hmm.
अच्छा, in this case, Hiran bhai and Dr. Sandeep,
1 minute
इसमें
only.
ankle,
Speak fast.
हाँ, yes, he should have asked for the ankle clonus. Is it must?
Ankle clonus, he checked the tone, but he did not pause. So I said all reflexes increase.
Yes,
So
actually
then
But
that
he
should
must
have been
go
mentioned.
for the clonus, no?
Yes,
If they are increased, then they must ask for the clonus
right.
also.
yes, yes, yes.
Perfect.
But he mentioned the tone at the level of ankle by doing
Hmm.
dorsal and plantar flexion, which he mentioned.
Mm-hmm.
He mentioned, but he did not say clonus. He mentioned in the
And
form of tone, which is the same thing.
hmm.
If increased tone at the level of ankle is clonus.
Mm-hmm.
The second thing is abduction, adduction also at the hip joint.
Mm-hmm.
Yeah.
I don't know time constraints. It was mentioned. They told in the webinar. I don't know whether once we are specifying all movements, no? So then abduction and adduction should be, I think, be included. We should.
Consumes 100% time. There is no doubt about this. Once you say, even you just mentioned flexion,
Hmm.
extension, abductor, adductors group, I will check power by saying him like, okay, raise your limb and don't let me allow to push and push out and push below, push up.
Mm. Chalo, we will discuss in
Pushing